мільйона дітей страдають аутизмом в Сполучених Штатах. Я зараз передаю слово.
So every treatment system is effective and functioning when we have a result or a positive outcome of this kind of treatment. So according to our joint program, as you see, we got this positive treatment outcomes. And what is good, we had a lot of discussions, of course, on the process of implementation of the system, but no dissociations. We were all united with our joint aim to help children, to help disabled persons. Now the lecture will be represented on ASD, on autism spectrum disorders, and currently it's the problem number one in the world, which is developing very quickly. And during our meeting previous months, it was in Saudi Arabia in Riyadh, on first international conference on disability, we met with Mr. Gary Badesh. Maybe I'll show you the picture of him as professor, and he told us that in USA currently is 3.5 million of children with autistic traits. Yes, come here. So we all think how to help those children, and we try to treat many cases of them here. Now we'll briefly show you how results look like. Here you see the photo from this international congress. This Professor Gary Badesh, he's the president of American Association of Autism. This is the biggest society of autism in USA. So if you look into the facts on ASD, one child in 68 now suffers from autistic problems, and currently there's more patients with ASDs than with diabetes, AIDS, and cancer. And the cost of life of a single person with autism is more than $3 million, and for all it's $137 billion. If you look onto the other researchers, average cost in 2025 is prognosed as $461 billion. Mostly it impairs males and females. They have worse social interaction, worse repetitive behavior, restricted range of interest, and delayed disordered language. And what we see that annually there's an increase in autism prevalence of 17%. There's a triad of disturbances of social interaction in this disease. These are problems in communication, adaptation to social needs, and self-realization. So in social sphere, the kids are not interested in playing games or interaction with peers. There's a stereotyped movement, so for 1 hour they put toys in one line for a long time. They have communication difficulties. For example, they do not express emotions by mimic after 9 months of age. There's no babbling till 1 year old, and there's absence of gestures, no reaction onto the own name. Also, they have motor problems, sensory problems, and intestinal problems. So these are the main ones. So the risk factors include gender. Yes, males are more addicted to this disease. This existence of a sibling with autism. Every fifth child whose brother or sister has autism will also develop autistic problems. This having a mother older than 35 and a father older than 40 years old when baby was born. And 20% of them, they have genetic problems. So usually early abnormalities include early onset or persistent muscle hypotonia, delay in gross motor functions, repetitive stereotyped movements like flapping or chewing, and atypical behavior or self-destruction behavior. Mostly these children are higher than peers, and they have less weight according to malnutrition and low energy intake. The areas involved mostly these are prefrontal cortex and temporal lobe. We see different MRI changes of all areas of the brain of them. We made a study aimed at analyzing incidence of common neurological comorbidities and gross motor function delay in ASD, and aimed at evaluation of efficacy of treatment using Kozyavkin method. So the retrospective study, time span has been 20 years, since 1995 to 2014, and almost 400 cases were monitored, aged from 5 to 14 years, which corresponded to diagnostic criteria of childhood autism. And what we have seen, so 90% of these kids were born preterm, with a population rate about 5%. Of them, 9% less than 33 weeks of gestation, 22% by cesarean section. Mean time for sitting was delayed. Breastfeeding happened only in 41% of kids, with a normal range of 72%. Infantile regurgitation, 71%, twice more than it should be. And respiratory diseases with hyperpyrexia happened much more often in their mothers. So what we may conclude that autism is not only psychiatric disorders as it is coded, but often we have concurrent motor problems and neurological problems, because only 30% of them, they had no other neurological symptoms. 26% they had pyramidal tract insufficiency, 22% perinatal lesions of central nervous system, 13% cerebral palsy, 8.5% is other psychomotor or genetic diseases, and 10% epilepsy. So here you see that in 79% of cases they are accompanied by hyperactivity, 59% attention deficit, 56% sleep disturbances, also mood problems and seizures. If you look onto the emotional sphere, the depression level of these patients is huge. It's 2 or 3 times more than the normal range. And also they have increased anxiety level. There's a severe speech retardations, speech problems, which you see on the screen. Also, they have a verbal memory loss, but mostly it's not a short-time memory, it's a long-term memory. So if we ask them to repeat a few words in 5 seconds, they will repeat all of them. But if we ask to repeat the same in 5 minutes, usually they forgot all. Also, they have a decreased intellectual development level. And here on this screen we see motor functions development decrease. So their functions of sitting, a normal range is 6 months, they have 8.4, 8.9. So it's almost 3 months a gap. Standing is 10 months normal range, and they have 12 months in average. Walking, normal range 12 months, and they have in average 16 months. So all motor functions are retarded. So muscle hypertone of upper limbs is happening to 58% of cases, and in lower limbs 42%. This is approved by the results of neuroflexor device, which also indicates on an increase of neural components. Also, if we look on the fine motor functions, we see a problem of all domains of power characteristics and manipulative fine hand motoric characteristics. And there's a correlation analysis has been done that indicates that dynamometry or power function of the hands mildly correlates to speech development. Box and blocks test and 9-focal test, which are corresponding to manipulative hand function, they usually improve speech a lot. Also, there's a problem of emotional sphere of these patients regarding their increased level of depression, their decrease in quality of life. Also, what is interesting, this ASQ increase in autistic traits of the parents. And the experience of treatment of these patients in our clinic indicates necessity of intensive complex approach for treatment of ASD. This is a complex we have just seen, which is complemented by methods of social integration. There's art therapy, occupational therapy, rhythmical group exercises, computer game therapy, group Olympic games for disabled children. And numerous examinations, they showed that the method has positive influence on not only on motor functioning, but also on cognitive functions like memory, attention, intellect, speech, emotional state, and all of these domains are related to improvement in quality of life. Currently, in databases exist up to 10 articles addicted to usage techniques or manual therapy for treatment of autism. And systematic review completed in 2011 concluded that given the ineffectiveness of pharmaceutical agents or insufficient effectiveness, a trial of chiropractic care for sufferers of autism is prudent and warranted. So here you see we've got improvement in motor sphere, in socialization, in speech, in intellectual quotient level, and according to autism treatment evaluation checklist scoring, we achieved improvement in domains of speech, socialization, and behavior. So after Kozyavkin method, this reduction of autistic traits is happening. So they have better social contact, they have new motor skills, they have improvement in mental development, concentration of attention, and for sure more evidence-based studies are necessary to be done by Kozyavkin method and its influence on ASD children. Thanks for attention.
Слово нашему коллеге, доктору Басаму.
Now it's a pleasure for us to represent Dr. Bassam, who is responsible for and the person in charge, one of the main ones about our collaboration. And now he'll represent the joint project with Cambridge. Please, Dr. Bassam.
Let me do the setup. My objective is to really debrief an overview of the Cambridge as an organization, as a facility, an overview of how we work with the Professor Kozyavkin on the SAP program, and hopefully a quick overview of how we can work with all of you, specifically the physicians from the UAE, on the program and other things we do in the facility. Cambridge Medical and Rehabilitation Center is part of a portfolio for TDM Capital. TDM is a private equity venture that's based in Dubai. Cambridge is one of its portfolios. We also have the Menzil Home Health as part of their portfolio. That's a sister company. Bone Hall IVF Center in Dubai and India, part of the portfolio as well too. And a pharmaceutical company in Egypt that's part of the portfolio. TDM owned or formed and operated Provita before its successful acquisition by NMC Healthcare in Abu Dhabi. I've been with the company just over a year, and I came from an acute care experience and mainly US experience for 21 years. So I really bring a bit of a fresh perspective, and I hope, yes, I am biased, I work for the company, but I also have been really touched by the things that I have seen, and I hope to share some of that with you today. The scope of what we do is all in the post-acute aspect of care. We have long-term patients of all ages. Our youngest baby came out of the NICU at Corniche Hospital, which is the children and neonatal facility in Abu Dhabi, just after birth. And our oldest patient, we believe, was 104 years old. So we have the range of services. Post-acute rehabilitation, so post-trauma, post-accidents, car accidents, and other traumas for a stay of 6 weeks to up to 6 months. The long term is with us a bit longer than that. But we also have ventilated care, so people, patients on mechanical ventilators, also of all ages. And our program aims to wean them off the ventilators. So we attempt with every patient that's fit to do so clinically, that we train them to start breathing on their own. So we have the transitional vent unit that we call it. Congenital, as very common in that region, we have that require long-term care and rehabilitation care for congenital cases and diseases as well. Quick overview of the facilities. We have in the UAE an inpatient, outpatient facility in Abu Dhabi, one in Al-Ain, and a clinic in Dubai. We're also expanding to the Kingdom of Saudi Arabia with a facility in Dhahran to open later this year. So I'll give you a quick overview of what is there. In addition to the services, we have consultant coverage, so physician consultants on our staff, pediatric, physical medicine and rehabilitation. And with us today is actually Dr. Nazakat, who's our Director of Physical Medicine and Rehabilitation Services. We have internal medicine, coverage Al-Watu, nephrology, and our physician coverage is 24/7 for the inpatients. Some photos of the facility in Abu Dhabi that shows you a bit of how it looks like. What you notice is a residential look. Because before this became a facility for us, these were residential villas. They were independent residential villas. 6 actually, there's 3 on each side. What we've done, we completely renovated and connected the villas, so you don't even notice anymore that these were separate at some point, and outfitted them to be properly licensed by HAD and every other accreditation facility as well too in the UAE. The look and feel is intentional, and we manage the look and feel that way as well too. We want it a home look because these are long-term patients that stay with you for a long time. Not only that, family come there as well too. Being long-term and being with you for at least, on average about 6 months length of stay on average, the families are very involved in the care. We have carers that stay with the patients 24/7. They sleep with them in their room, so we properly equip the rooms for that. And if it's not a family member, then it's somebody the family hired to be with the patient. We do have cases where the whole family stays with us as well too. We have a patient who had a car accident, has been quadriplegic, and going through a rehab, long-term rehab, and the wife and kids are there most of the time, 24/7 as well, especially when the school is off, weekends, and summer breaks. So we have this home feeling, which it's extend also, beyond the clinical care to being very attentive to the patient experience and to the family experiences. So we have a patient and family experience council, we have patient and family experience teams, we have planning meetings for care with the family, but also to address all other aspects that comes up. And this is also part of the Abu Dhabi facility. What you see in the back is our gym in the Abu Dhabi facility. We have 3 gyms actually, a female gym, a male gym, and a pediatric gym inside the facility. We also have a hydrotherapy pool in Abu Dhabi, and the same thing in Al-Ain as well too. The brightly colored one, we call it the disco room. It's our multi-sensory room that is used as well. And you see some inpatient as well as rehab pictures as well in the facility. Orion came on board a bit later than Abu Dhabi, so the company started in Abu Dhabi, then moved to Align and opened. We have the same services. The only difference in Align is we have two hydrotherapy pools, so we have an adult pool as well as a pediatric pool. We've learned from what we've done in Abu Dhabi, so there were more enhancements to the Align facility. The look has a bit more of a green, this being Align, two pools, and there's been a lot of attention to the design aspect as well. This is one shot of how it looks like in Align. Again, similar residential type facility that have been transformed to become a rehab center. Pretty much similar to what we see in Abu Dhabi with the same services for inpatient and outpatient. Both facilities are licensed for 80 beds, 90 beds license. Actual capacity is about 80 plus. Abu Dhabi is around 90+% capacity, so we're almost full. And Al Ain is up to 65% capacity. Recently, we purchased a clinic in Dubai. It was our entry to the Dubai market to start expanding in Motor City, Dubai. We opened it officially in December. We just onboarded, I believe, the last staff member last week or the last 2 weeks, so it's in progress. And then you see our KSA facility that is planned to be open, well, inspection in August. So the construction renovation will finish in end of June, then the KSA Ministry of Health will come for inspection. So we're hoping everything goes well, and we open later this year in KSA. It's in Bahrain, in the eastern region, very close to the Johns Hopkins Aramco healthcare, and we have a strong relationship with Johns Hopkins Aramco that we will be the referral source for Johns Hopkins Aramco in the region. Now, the relationship with Professor Kozyavkin and his team has been truly one that's very satisfying and fulfilling. You've seen the live Skype session from our lead rehab therapist in Align this morning. So as we speak today is the last day of the cycle in Align facility where we have 14 patients undergoing the cycle. The relationship with Professor Kozyavkin and his team goes back over 2 years when the initial discussion started. I had the privilege and the honor when I joined the company to kind of take over, I wouldn't say negotiation, it was more of really coming together with a passion to bring to the UAE what they do here in Truskavets. And we worked through the legality and the logistics and the licensing. And we launched our first cycle in December in a Lion facility. That has been a tremendous satisfying feeling for all of us who've been involved in this. Not only we truly enjoy working with the professor and his team, but the impact on the patient and the children has really been amazing. And I'll tell you a story or two. This is actually my last slide, so I promise to be brief, just an overview. Then maybe another slide. But part of this relationship is the center is actually accredited and certified by Professor Kozyavkin for the method. So an accreditation team came to UAE and inspected the facility as a facility to make sure it's fit for the purpose. We have staff that came to Ukraine for special training and have been certified as well to use the method. We actually have more staff arriving Saturday. They're leaving UAE tomorrow and arriving on Saturday. Another batch of staff, physical therapists, to come for the training. We also have staff, so Dr. Nikos, the one that gave the Skype session, is part of Professor Kozyavkin Institution, and he's been HAB licensed, and he's been with us full-time during these cycles to provide support to our own licensed therapists as well too. The way it works, it's a cohort session. So there's a screening first, there's a referral of patients, and if they meet admission criteria to the program, so they must not have had any surgery on their spine or back, so There are some specific criteria to be admitted for this intensive rehabilitation. There's an assessment, a clinical assessment, and then they're accepted into a 15-day, what we call the cohort. And the cohort runs for 15 days. Friday is the only day off where everybody takes a break. The day one of the cycle, as we call it, the cohort, is a clinical assessment where we have our own PMNR physiologist who've also been trained and customized with the Kozyavkin. Assisted by, in most cases, the professor himself is there with us, as well as Dr. Taras, who's been speaking with us as well too. They've been there for every one of the cycles to kind of oversee and offer support to us. First day is a clinical assessment, and based on each individual patient, a rehab schedule is done for the next 14 days. So at the end of the clinical assessment by a multidisciplinary team, clinicians and therapists, an individualized schedule is done, and then the patient come back for about 4 to 5 hours every single day for the next 14 days. That's what we call a cycle. Today we complete our 5th cycle, and every 3 months, so there's a 3 months break in between, and then the same cohort comes back. So in April, in this cycle, we had the December cohort come back for a second cycle as well too. This is just some of the stories, and of course we have permissions from the patients that have been very involved with our marketing and testimonials, and obviously not all of them CP. But I'll conclude with a story. Before I do that, let me just cover the basics. We have a relationship with Spalding. Spalding is a Harvard-affiliated medical rehab institution in the U.S. We have a strong affiliation with them, as well as we obviously have the Joint Commission and the CARF and other accreditation as well too. I'll finish with a story, then I'll probably ask Dr. Nazakat to offer a bit of insight on our approach on multidisciplinary care as a whole. So let me tell you, if I did not see it, I would not believe it. As passionate as I am about the professor and his method, and I've been working with them closely for over a year to bring this to UAE, and before me, Dr. Khalid and others have been working on it, the things that I've observed, if somebody else told me, I just would not believe it. We were doing a round, myself and the professor and other team members. This happened about 2 cohorts ago, and we were walking, and we in an iron facility in the hallway where the clinic is. So we have it fully equipped as per the professor method specification, and we meet this parent, an Emirati father. Assalamu alaikum, how are you? Alhamdulillah, how are things? And the professor told me, so ask him how things are going. So, and here is talking to me in Arabic, and we had somebody, I think Taras was translating, and he's telling me things are going well, alhamdulillah, we were just talking, the 4 of us. Then literally he stops, and he does this. Okay. We're standing here. He was no longer looking at us, and he looks here. It turned out his son, Ahmed, who's about 14-year-old on a wheelchair, was coming out of the toilet, right? And as if we did not exist anymore. The Ahmed? Yes, Baba. You're done? Yes. You did the thing? Yes. You sat on it? Yes. And you cleaned? Yes. You washed? I mean, that's exactly in Arabic how the conversation was. Yes. You pulled your underwear? Yes. You pulled your pants? Yes. Then he goes back to us and he said, I can't believe it. It's been less than 10 minutes. It take him more than a half an hour at home. I can't believe it. Tell the professor, tell the professor. Now, if I was not there and somebody tells me that from the first session something like that would happen, I would say you're exaggerating. I would say, you know what, yeah, it's a great program, but don't tell me that in one cohort you would see such a difference. Okay? And cycle after cycle, so I am there every time the cycle runs in the 15 days in a line. And I'm now known to ask for a story. I go around, Khulud runs is the manager for the clinic, and I say, what's the story of this cohort? We had a high five story. You know, how many of your kids can do high five? How often do you celebrate a high five? How often high five is worth talking about? A 2-year-old in the first cycle is giving her dad a high five. And that was the story in a line for that cycle. I mean, it's amazing what you see with the patient and the families. I've been inside some of the sessions with Professor. I've seen the manipulation, and I've seen people not able to walk properly, and actually not able to walk, and then being able to hobble around. It's absolutely amazing. And I really want to thank you for what you do for the children and what we've done together for the children and the patients in the UAE. It really is an amazing story. And we have an amazing team, an amazing partnership that are so passionate about this. And we plan to grow this impact further and further. And you've seen from all the evidence, we're passionate about it. We're also passionate about this being evidence-based and that there are KPIs that we measure. One of the conditions we have actually with the Department of Health as well as Daman is that a set of KPIs where we have to show and prove that what we've worked here in Truskavets is actually working in Abu Dhabi and worth doing. So it's been an amazing ride together with the professor, and I hope you're able to see and live and feel what we see in a line working with the professor and his team. Dr. Nazakat, you want to give a...
Thank you very much, Dr. Bassam. I'm sure you can see how passionate we are about this program. Actually, I have recently joined the Cambridge Medical and Rehabilitation Center. I actually set up initially a department, the American Hospital Dubai Rehab Department. And my colleague actually is here as well, who has replaced me there. So it's about 3 months. And I'm here as somebody to be introduced to this actually system of treatments. I'm not an expert here, but I will briefly talk about how actually we work as a multidisciplinary team. I'm sure most people here are from the rehab background and they are aware of the importance of involving all the professionals, which of course again most people will know that's a recent trend. In the past, every professional used to do their own business. The doctor would probably see the patient and do some prescription, some treatment, and they will go and probably refer to physiotherapists, and they'll go to some other place, have a physiotherapy clinic there. The physiotherapy will do some treatment, and they never talk to each other, or they never communicate with each other. But recently, we have realized that that's not the right way of treatment, and you can get much better results if you work closely as a team. And this is actually not only in rehab, in most of the medical services now, this approach is working. But we definitely think that rehab actually has been the pioneer in that. So we work very closely. So our team of therapists, I think, if I'm not wrong, probably the pool is around 55 therapists, which probably is the largest pool of therapists in UAE. In our center, both of course across Alain and Abu Dhabi. So we do have specialized therapists, so they do of course have general training and then subspecialization in different neurological conditions, musculoskeletal conditions, and stroke. So we do provide a subspecialist level care as well. Same is true for our physicians. Our physicians, we're around 20 physicians, so we've got a very good as Dr. Bassam explained, coverage of medical conditions. So myself, I'm trained in physical medicine and rehab from UK. My subspecialty is in spinal cord injuries and musculoskeletal conditions. And that, of course, is then potentiated with my colleague who is Dr. Suhela, and she's got more interest in neurological conditions and stroke as well. So we do actually provide good broad spectrum cover for general rehabilitation conditions. We also have two pediatric consultants who are actually, again, more interested in the rehab side of pediatrics rather than just general pediatricians. We have two intensive care consultants as well, so people who are on artificial ventilation, who are being weaned from ventilation, or who do need hemodynamic support if they become unwell. So we've got very good, strong medical backup. We also have two consultants in internal medicine, so general respiratory infections, chest infections, blood sugars, hypertension, diabetes, so renal function. So they are excellent to provide that cover. So we've got actually a full spectrum of medical cover to our patients. Of course, we don't do any surgical procedures, but everything else we can provide easily under one roof. The discussions usually are as soon as we get a referral. So whole team will sit down, including pediatricians, hospitalists, PM&R physicians, our team with speech language pathologists, occupational therapists, physiotherapists. They all sit down, social workers and case management as well. We sit down, discuss, make a plan before even accepting a referral. Then we go visit the patient, see them there, do a detailed assessment, professional assessment both by physician and the therapist. And then of course we come back, rediscuss again as a full team, and then make a decision whether we can actually do something for this patient or not. Once we have all guidelines, which are of course COUGH, we had a recent assessment and we passed it and we've been accredited for the years. So I think again we are the only rehab center who has got both for inpatient, outpatient, pediatric and adult, both JCIA and CARF accreditation. So of course these things are they look in detail, every piece of paper which you're writing, every information you're putting down. So I'm glad to say that actually we're following all international standards and guidelines as well. So yes, I'm looking forward to spend some time here and learn. And of course there's been some exciting stuff which has been done in Elaine. So I've been involved, I've been seeing firsthand. And of course this is my first experience as well. And the results are really amazing. And we're looking forward to have a long-term positive relationship with, of course, the International Rehabilitation Center here. Thank you.
Thank you.
Я хочу вручити, значить, таку сувенірну нашу пам'ятну подяку містеру Васану за співпрацю.
This is special thanks to you for your position, for your collaboration, hard collaboration work.
Дякую. Щиро дякую. Значить, я маю таке прохання. Перше. Ви розумієте, ми знаходимося в клініці, перше. Друге. Тут багато було бажаючих різних, які подивились пацієнтів. Тут є 150 пацієнтів. Якщо всім дивитися, треба буде мінімум на тиждень залишити.
I would like to ask you, as you know, this is a clinic, medical center, and currently we have more than 150 patients. So if you would like to see all of them, it would take maybe 1 week.
Но, оскільки ми порадились і прийшли до висновку, що в першу чергу бажано було би подивитися когось і поспілкуватись з пацієнтом, який приїхав до нас з арабського світу, звідти араб.
So we thought on selection of patients, like whom to show, and the best option was to select ones from GCC.
Дуже важливо те, що є прохання. Ви знаєте краще, що мама, вона просить не знімати відео, забрати камери, вона буде говорити свої враження, тому що як все вона прекрасно, як професор орієнтується в ситуації. Ну і потім ми подумаємо, у нас є документальне відео, в якому стані був хворий і в якому він...
This is one mother from GCC, but there's a special request, and she asked no photo, no video, please, in any way. Okay, so speaking